Okay, friends, you're welcome to our YouTube channel, The Wit Chats. I've said repeatedly in the previous session that we'll be having quite a number of professionals, people who will be so successful in their careers. And today, I'm super excited, really, to have one of the greatest professor I have seen or have been so close to have him share a kind of very useful information regarding a very hot topic. And it is a rare privilege for me. I'm so much excited because even when I stormed on his CV, his resume, it took me several hours to be able to summarize his resume. So, Prof, I hope you will pardon me when I read out your resume, because I'm so sure I'm going to omit, maybe not intentionally, I'm going to omit some possibly important information in your resume, because your resume is cumbersome. So the guest we have today is an accomplished professional. He's a professor, and his name is Professor William Arthur Musai. Professor William has a lot of information, a lot of things I need to say about him. So in the next couple of minutes, I will just try as much as possible to say a few things about Professor Williams. Like I said, he is an accomplished professor. He got his bachelor, precisely he has 2 bachelor degrees. And also, I could also see that Professor William had 3 master's degree as well. Bachelor of Arts in Psychology, also Bachelor of Science as a associate physician, and Masters in Divinity. That is so surprising when I saw that on his CV. Master of Arts in Teaching, Master of Planner in Advanced Studies. Really, this is so much for me. And also, he has a 2 PhD as well, one in medicine, and the other one is education as well. Education, especially in research and professional doctoral degree. And his dissertation is what he wrote on the effect of emphatic listening skills training on child care providers. That was in 1987, if I got that right. So you can imagine 2 bachelor degrees, 3 masters, and 2 PhD. That is so amazing. Prof, one of the things I would like to emphasize on before we even start anything is that I would really want you also to feature in our next meeting, where you can share with us how to be a successful career individual, how to be successful in one's career. Because I can see from your profile, you are indeed successful. And I believe you have a lot of things to share with us from your experiences. How, for instance, a young scholar like myself, like my friends, like every other individual who will be listening to you, what we need to do to be as successful as you are. That would be so much interesting to do. So I hope we're going to have you next time to do that for us. So Professor William also, he has worked as a professor and professionals with several institutions and universities across the globe, several of them in the United States, before he became an affiliate of Istanbul Geleshim University. He has also been working in Texas A&M University, University of Mary Harding, Baylor, University of Texas, Pan America, Nova Southern University in Florida, Wright State University, and Linda A. Cohen Center for the Study of Child Development in Ohio. And presently, he is currently the director of research in that same institute, that is Linda A. Cohen Center for the Study of Child Development. So, and in addition to that, I would really want to mention that this is also strange, that Professor Willem is a retired Lieutenant Colonel in the United States Air Force, Reserve and National Guard. This is amazing, really. So he has worked with the United States Army as Desert Storm in Iraq, in Afghanistan, and possibly in some other areas as well. And he has won also several awards. He has received several awards. Among those is an outstanding Early Childhood Teacher Educator of the Year from the National Association of Early Childhood Teacher Educator in 2020. Also exceptional service to refugee community. I believe he has some information to share with us regarding that, because currently he's also working with the Syrian refugee here in Turkey. Also won award with Humanitarian Service Award as well, Humanitarian Service Award, Joint Service Communication Medal, Joint Service Achievement Medal, Meritorious Service Medal, Bronze Award for Scholarly Writing, and list goes on and on. His research achievement include several publications as book and book chapters, which is, I actually count that should be over 20 published book and book chapters. And several of those numbers also, he has book and book chapters that are currently under review. And he has several referred and peer-reviewed international studies that have been published in reputable journals across the globe. He also had non-referred published magazines and newspapers articles, professional presentations in regional, national, state level, and local levels across the United States as well. His professional services include services to the national, states, and local level organizations. He currently held several professional certifications. For me to start mentioning some of these certifications, we need several hours to do that. So, Professor Willem is also a professional member of Aerospace Medical Association and is a life member of this association. He also holds a membership with American Association for Marriage and Family Therapy as a clinical member, American Psychological Association as a clinical member, and several of those membership. In addition to that, Professor Willem is also a member of Association of Ministry Surgeons of the United States. He is also a life member of this particular association. Amazingly, he speaks 2 foreign languages, Spanish and Portuguese. He could write, he could read, and he could speak. And in addition to that, he understands Turkish. Professor Williams, Horst Gedines. You are welcome, sir. I'm so happy to have you here this day. It's so exciting for me, really, because you are one and the first most accomplished individual that we have actually going to feature in this channel. And I'm so sure that the guests we have a lot to learn from you, from your accomplishments. Professor Williams, you're welcome to our program today.
Thank you for having me.
Friends, we'll be having very important discussion with Professor Williams. The first of that will be on child development. There is no any other individual to speak to us on this topic rather than an accomplished individual, someone who is an expert in that field, someone who has done a lot of research in that field, someone who is also still practicing, someone who has taken the role of child development as a hobby, not only as a hobby, is also using it as an opportunity to contribute his own quota to humanity. That is why we'll be speaking with Professor Williams on this particular important topic. So, Prof, to start with, I would like you to take us through the meaning of child development.
Okay, well, the term child development refers to the physical, cognitive, and emotional changes that occur in a human being from birth through roughly age 18. And those three aspects can be more easily refined as cognitive development refers to our ability to learn new things, to solve problems, to manage social interactions and regulate our emotions, to master self-control, and to use verbal expressive language, to understand and use language and read and verbally communicate with others. And then physical development refers to the fine motor skills, how we can manipulate things with our hands, as well as our gross motor skills, our large muscle movements, and the sensory awareness that we have of our surroundings and the ability that our senses have to register the information that we intake from our phenomenal field.
So, thank you so much, Prof, for that enlightenment. And one of the things you mentioned while you were trying to illustrate what child development is about the age 18. I mean, all the manners, the aspect of development in child, or from childhood up to the age of 18. I want to ask specifically, why the age 18? Why the age 18?
Well, see, this is a very interesting question you're asking, because in Europe, child development refers to that span. In the United States, child development more specifically narrows it down to just birth through roughly third grade, through roughly age 9. Why? Because 80% of all human learning occurs in the first 8 or 9 years of life. But for completeness, we refer to the teenage years, adolescence, as part of childhood. But technically, once a person is roughly 13, their brain is fully developed like that of you or I. They just have less experience than we have.
Now I see. So can we say, Prof, that that age 18, is it something that we can associate with the age of consent that is always being, how can I say, being argued across the globe?
That's the only reason it stops at 18, because of the legal age. You see, during the Middle Ages, it was considered age 7. A child was considered able to go to work once they reached age 7. But in modern times, it's moved up to age 18 for the age of consent.
That is, thank you so much, Prof.
But technically,
yes,
in terms of females, a female can gain her independence at age 16 if she demands it through the courts from her parents.
I see.
So the whole area from roughly age 13 to 18 is a minefield of development that's just an adult brain with limited experience.
Oh, that is amazing. You know how this actually instruct or better inform us how unique humans are. We are so unique in nature, really. Yes. Yeah, Prof, I know that you are very busy. I know that, And currently you are engaged with a kind of humanitarian service, if I'm to put that in perspective, with some children, mostly the Syrian refugee. Can you try to provide us information regarding your engagement with children?
Okay, I currently work at 2 locations, a rehabilitation center for the children of Syrian refugees and a child development center for young children. Both of them are in a part of Istanbul where many Syrian refugees reside, and that's called Ayzinyurt. I assess children's development. I provide diagnoses for the children's conditions. I make treatment plans and recommendations, and then I train staff on how to implement developmentally appropriate intervention strategies, individualized to address the needs of each individual child. And on top of that, I train the parents how to do the same activities at home.
So you must be very, very busy, you know, so to managing this schedule. And at the same time, you are also giving lectures as a professor in the university. You must be very busy.
Yes,
you must be passionate about this.
Yes, I also teach my 6 courses at the university.
Oh my God! Oh my God! Prof, really, to put it in perspective, I think your passion should be one of the things that is driving your engagement. Because if I'm to say you are so much busy and you still have that time, you know, to give to humanity, this is really amazing.
Well, to me, my mother raised us children to think that work and play is synonymous. You should love what you do. And so I don't really think of my courses I teach at the university as drudgery or working with these refugee families. I don't see it as a chore, but rather as a moral, ethical obligation to help humanity.
Oh my God, this is fantastic. This is fantastic. So, Prof, while we're talking about child development, so this brings us to the issue of special needs with children. So, because in a case where during the process of child development, when there are challenges, issues regarding maybe speaking, vision, like you just mentioned earlier on, and which would mean that such kid could have needs, which we say maybe special need. Now, how do you tend to differentiate when there is a mere challenge in child development or in the development from childhood to the case of special need?
That's such an important question. And sadly, there are not a lot of doctors in the world who get training in developmental pediatrics. And so it's a very, very important field, and yet not many professionals are available to help families when they have a child who they're concerned about as potentially having a special need. So to answer your question, all children develop at different rates. Some children have delays in development and will require early intervention. And typically early intervention has to occur before the child is 2. However, in most children, developmental delays in mental or physical development will resolve on their own. And so no intervention is needed. The key, the trick, the sensitive issue is being able to differentiate which child needs additional help. And we refer to those children as children with special needs. So some children have significant developmental delays that indicate that they're going to eventually have a significant learning disability. Delays in development, however, differ from disability to disability. For example, some are improved with intervention, but some, as I said before, don't really need intervention, and the child will mature not out of the disability, but will be able to adapt to it. The classic example is dyslexia, writing letters backwards, writing dyscalculia, writing numbers backwards. This is a very common genetic, quote, disorder, but it's just a variation on normal in human beings. I myself was diagnosed with dyslexia as a child. You never grow out of it. As an adult, I sometimes still write my S's backwards or my 5s backwards. But in this day and age with word processing, I don't have that problem much anymore. But the big thing is that although some developmental delays, we might call them, will seem like they disappear as the child gets older, we know that there are some that will not. So for that reason, it's important to be aware of the early signs of developmental delay. Some disabilities are linked to exposure to risk during the prenatal period. Some disabilities are related to parents being cousins. Some disabilities are preventable through the appropriate prenatal health care and appropriate healthy prenatal lifestyle choices. Delays can be normal for one child and no intervention is necessary. That's the take-home message. However, learning when it's a neurological difference in processing information that is more significant, more severe, special intervention is required. So developmental disorders can be the result of differences in the way the brain processes, understands, and uses information. So types of developmental delays can be cognitive, can be communication, maybe social skills or emotional functioning, or just behavioral. Some may be related to cerebral palsy and have fine or gross motor skill difficulties. So everyone has differences in their learning abilities, but people with disabilities will have them for their entire life. So there's a difference between the term developmental delay and the term developmental disability. A child with a developmental delay might be able to catch up to other children by the end of early childhood, roughly age 9. But a child with a disability is going to have it for life, and it's more severe, which is why intervention is so crucial.
Crucial. Early intervention. Yeah. So thank you so much, Prof, for providing this very useful insight. And while you are trying to differentiate between development in child and the severe case of special needs, you mentioned the causes, rather. You attributed some of these causes to hereditary, to cognitive issues and environmental deprivation or thereabout. And you also hinted that that is why one should not marry our own cousin. And that actually struck me because when we talk about marry within the family, I mean, for example, marrying own cousin, I always think that this is often more of, can I say, religion or traditional or cultural beliefs. So I have never imagined that it also has a lot to do with child development or delay in child development. Prof, can you please expatiate on that? Why marrying own cousin is not just religious or traditional belief. Can you tell us about the medical side of this?
Okay, I can give you a specific example. When I was in the military as a medical officer, specific family I was working with when I was stationed in Afghanistan, and this father said, "Oh, I have 12 normal children, and all 4 of my wives are my first cousins. So it can't be that this one child has a developmental anomaly because we're cousins." The lack of educational understanding of genetics makes it difficult for a parent to believe, because if you have 12 normal children, by luck of the draw, of course, even if you marry a cousin, most of them will come out normal, of course, because that's the way the genes in our chromosomes work. Okay. You know, the human race would have died off eons ago if it was not relatively easy to have a baby. So, and a baby that survived to adulthood so that they could also procreate. So the dilemma is that in this father's case, he could not accept that there was this, because there is this 10% chance that if you marry a cousin, you will have a child with every single pregnancy. There's a 10% chance that the child will have a congenital anomaly that's undesirable. So the risk that you were asking about is related to the chromosome makeup of the human being. Our DNA is structured around these 23 chromosomes that come from the father and 23 chromosomes that come from the mother. And if the mother and the father are related, then there's so much similarity in the chromosomes, there's not enough diversity to filter out the potential for a congenital anomaly that ends up being undesirable. The many examples could be types of retardation, types of skin disorders, like this boy in Afghanistan. He had no lanolin in his skin. You know how some people have dry skin and some people have oily skin? Yes. Well, that oily substance is called lanolin. And some of us by nature have less lanolin in our skin, so have drier skin. But if a person is born without the ability to produce lanolin, then the skin is cracking all the time, all over their body. So all they can do for their whole life is just spread Vaseline all over their body to control, to control that problem, which is caused by marrying a cousin. So there are hundreds of developmental disabilities that can result from marrying too close to the family tree, as we say in English.
Really?
That's why it's wise to marry someone from a different culture, even.
Thank you, Prof, for this very, very useful information. Really, really, because I've always tried to attribute such beliefs, to either tradition or religion. So I'm so excited that you are able to provide a medical justification for that. Thank you so much, Prof. And I believe our viewers also will find this very useful. Prof, in regarding your current engagement in providing assistance to children with special needs, can you say that, I want you to speak from the perspective of the parents now. Can you say the experience of the parents is a mixture of hope and pain?
Absolutely. Most parents are not child development experts. And so they might be in denial for the first 3 years when they have a child that's born with a disability. And sadly, frequently, that is too late for optimizing intervention. Many disabilities, which are referred to as hidden disabilities, are called hidden disabilities because the layperson doesn't see them. You have to be an expert to notice most disabilities in children. So a hidden disability is by its nature difficult to diagnose, difficult to detect. And only someone well-trained in developmental pediatrics is going to notice the subtleties to get an accurate assessment of that child. So parents, by the time they actually seek help, often they have to deal with the painful realization that their child has significant limitations that will last for life. I can give you an example. There is a mother, one of the Syrian refugee families that I work with. The mother brought her son who was diagnosed with autism spectrum disorder when he was 3. He's now 12, but he has no language. He does not speak, nor does he understand language. So that means he doesn't have even receptive language. But she had this dream because of the television program that's in the United States, in China, even here in Turkey, called The Good Doctor, Mucizi Doktor, which is about a person on the autism spectrum, a person with Asperger's syndrome, who ends up going to medical school and becomes a surgeon. Well, she had this delusion that her son was going to become a surgeon, even though he has no verbal language skills yet. So it was so painful for her.
Oh my God.
To learn the truth once I explained it to her. However, on the other hand, I work with parents who have found new hope for their child after just 2 months of intervention working with me at the rehabilitation center. For example, another 12-year-old with cerebral palsy. The mother was told that her daughter was mentally retarded as well as physically handicapped and would never walk. Yet, the child was fluent in English and Arabic. So why would any doctor have told the mother the child was mentally retarded? It's heartbreaking. So after just 2 months of me working with this girl, teaching the staff how to provide the physical therapy, she now is walking.
Oh my God.
Now, of course, she walks like a person with cerebral palsy. She doesn't walk like you or I. Her gait is halted because of the damage during childbirth process, the oxygen deprivation that damaged the occipital lobe, which is the motor cortex for the brain. However, her cerebral cortex wasn't damaged. So even though her tongue could not pronounce words clearly, that didn't mean that she had no intelligence. So once I explained that to the mother, oh my goodness, now the mother is gone full charge, getting her 12-year-old daughter enrolled in regular school with regular children, so that she now is learning a third language, Turkish. She just doesn't speak, enunciate like you and I do, because of the cerebral palsy. She talks like this, but that has nothing to do with cognitive ability. Her intellectual ability is intact. So that the sad thing is that someone had misguided the mother, so that for 12 years, the mother thought there was nothing that could be done and gave up hope and just was wheeling her daughter around in a wheelchair until she met me. And I said, no, we need to strengthen the muscle, the quadriceps in your daughter. She can walk. And now 2 months later, she walks without a wheelchair and without a walker.
Oh my God.
Sure, for the first month, I moved her to a walker. Then at the end of 2 months, she had enough strength built up in her quadriceps, the 4 muscles in the thighs, to be able to walk without falling down without a walker. Another example of helping parents feel hope is a little boy, Adam, who had oxygen deprivation at birth. And we don't know for sure that it was because the mother and the father are cousins, why this child, Adam, has his intellectual disability and autistic behavior, but it doesn't matter how it happened. Intervention is what we have to focus on. So you have this 11-year-old boy who has been saying to his mother and father for years what we call lelations, that is consonant vowel sounds like baba, dada, mama, ana. And they didn't know that if they focus on those sounds, that builds language. So now when he wants a drink of water, he says ana bidimai, that which is Arabic for I want some water. And because he has autism, previous doctors had told the mother and father that don't get him glasses, even though he has severe stigmatism, which he has very difficult time seeing and walking because of difficulty seeing. So I took him with the parents to a pediatric ophthalmologist. We did the diagnostic assessment of his eyes. We got him glasses, and now he can walk by himself because he can see better. So, right, there's no cure, but because of his cognitive limitations, glasses were important because that would provide another sensory field for him to respond to in terms of learning from his environment.
This is a whole lot of experience, really, Prof. Prof, you know, this reminds me of my high school day when I was in high school. So we used to have one of our friends in the class, and he has the autism issue. And one strange thing about him is that, Prof, this guy used to be most likely maybe top 2 in the classroom. I mean, maybe the best student in the classroom, especially in mathematics. There is no match. There is no match.
he had the type of autism spectrum disorder that's referred to as Asperger's syndrome. Only 12% of people on the spectrum of autism have high cognitive functioning. Most of them have an IQ below 70, but he's one of them who's in that rare case, like the Good Doctor television program.
Yes, yes. I see. Ah. Then, Prof, while you're explaining, also you made mention about oxygen deprivation during
Yes.
prenatal. And now, okay, can you also expatiate what are the likely, can I say, habits of the mothers during pregnancy that could predispose a child to those challenges that you just mentioned?
Okay, there's only two things during pregnancy, placenta previa and placenta abrupta, but those are very rare. That's where the placenta isn't in the normal position on the back wall of the uterus, but instead detaches itself so there is less oxygen going to the baby through the placenta, or placenta abrupta, where the placenta is sitting right in front of the cervix, so the baby can't come out. And these two rare circumstances, which are detected easily on ultrasound. So with ultrasound, those are, in my 30-year career, I've seen about a dozen children who were born placenta previa or placenta abrupto and had a special need. But typically we operate fast enough and then they don't have a developmental disorder. However, most oxygen deprivation is caused from a mistake by the obstetrician during delivery, not something that happened during pregnancy.
So, Prof, I don't know if I should answer you this, because I know you're a doctor, you're a medical practitioner, you're a doctor as well, and you have what we call, hypocritical oaths. And,
okay.
Yes. So as a medical
Hippocratic oath.
Hippocratic oath.
Yes, because Hippocrates, a Greek scholar, came up with the term, and he was considered the father of medicine. So it's called the Hippocratic oath.
Hippocratic oath. So
in
such situation, Prof, when the fault comes from the pediatrician, okay,
the provider.
Okay, so do you think such a doctor will be so willing to disclose the cause of such to the parent?
No, this is one of the tragedies. No, they never admit it. One of the most common misconceptions that parents have is that, oh, your baby has was, quote, born dead, or has a developmental disorder because the cord was wrapped around his neck and he couldn't breathe.
I heard that a lot. Yes.
Now, number one out of every 3 babies has the cord wrapped around the neck. Does 1 out of every 3 human beings have a developmental disability? Of course not. No, it's less than 1%. So that's absurd. Number 2, we don't breathe through our mouth, so when we're a fetus, so the baby in the uterus is not breathing through his mouth, so they're not choked. No, not at all. The oxygen comes through the umbilical cord directly to the heart. So through the umbilicus. So all nutrition which basically is the oxygen that's needed for the fetus to grow, to develop, is provided through the umbilical cord. It has nothing to do with the baby breathing while they're in the womb, because babies don't breathe in the womb. It's full of fluid, water. It's full of urine and feces. The baby swallows his own urine and his own feces every day and then flushes it back out. It goes in and out, in and out. It's just normal.
Normal.
Yes.
Oh my God, Prof, this is a whole lot of information. Really, this is so lot of information. Yeah, Prof, with your more than 30 years of experience, and especially with your current engagement, providing assistance to the special needs kids, what is the feeling for you, Prof?
Well, I feel like I'm doing something useful for humanity. I have a motto that I've had for as long as I can remember. I'm telling you, I've had this motto since I was 9 years old. That's as far back as I can remember reciting this motto. And this motto is, I pass through this life but once. If there's any good that I can do, I better do it now, because I'll never pass this way again. So I've just lived by that my whole life.
This is this is fantastic, and this is true. This is true for everyone. We have just one life to live. When that life is gone, that is it. This is true.
That's it.
Yeah, that is it, Prof. That is it. Okay, thank you so much, Prof. And that brings me to another thing that I want to ask you. I would like you to share more light on, which is about how to identify the kids with special needs at the early stage, or the early part of their lives. What are the steps, or what are the ways that such kids could be identified by the parents specifically?
Well, as I said before, because the average parent doesn't have any training in child development, the average parent wouldn't even notice. Most families that I work with always say, oh, my child was perfectly normal until they were 3. Well, that's impossible based on the symptoms that I'm observing in their child. And maybe now their child's 5 or 6 or 7 or 8 or 9 or 10 or 12, or sometimes 20. And the parent will say, the kid was perfectly normal until he was 3. Impossible. But the average parent doesn't know what to look for. So to answer your question in as concise as I can for something that's taken me 30 years of experience to develop the expertise in, we're talking about knowing what developmental milestones are typical in the developing human being. Now, we know that by the first day of life, by the time a baby is a few hours old, they can start copying what they see you do. So if now with the hundreds of babies I've delivered, if I stick my tongue out at a newborn, the newborn will look at me and study, and then start doing the same thing. So that is an indication that the child is intact cognitively. But the very common milestones are being able to lift their head by 3 months, be able to roll over by 3 months, be able to sit up without help by themselves by 6 or 7 months, be able to stand by 12 months, be able to walk by anywhere from 12 to 15 months. Those are typical developmental milestones. Here in Turkey, I'm shocked that the average Turk starts toilet training when a child is 1.5 or 2. That will cause, no wonder I see so many teenagers who are emotionally disturbed, who have anxiety problems, because they were pushed to toilet before they developed sphincter control. Normal sphincter control in a human being, we call that the anal sphincter and the sphincter related to your urine output, comes volitional roughly around age 3. So we should not be trying to force children at age 2 to get out of diapers just because diapers are expensive. You should use cotton diapers instead of buying them if your concern is the expense, not trying to push a child out of diapers. And I find that a serious problem, especially with special needs children, because of all of the psychological overlay that can result from pushing a child to toilet train too early. So another developmental milestone is the use of language by age 3. We know that by roughly age 3, a child has full receptive language, understands everything that's being said to them, and starts then using 1 or 2 word sentences. That's why it's easy for me to know if a child has a developmental delay. If they're not speaking in 2 word sentences by age 3, then I know they have a developmental delay and they've had it their whole life. The parents just didn't notice it. I'll give you the classic example. Babies I've delivered who were born blind. Guess what? You can't tell until roughly 6 months if a baby is blind. You know why?
No, sir.
Because a smile is a reflex in a baby. So the mother will think, the parents will think, the baby sees them when the baby smiles, but it's just a reflex. The babies I've delivered that are born deaf without the ability to hear, typically they don't get diagnosed until by the time they're 1 year old. Why? Because it is a normal part of brain development for babies to make these sounds. Ba, 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 da, da, ma, ma, pa, pa, ana, which are the typical sounds in all cultures that are used for mother and father. So the parent just jumps to the conclusion, oh, my kid is calling me mama, ana, or baba, dada, papa. Oh, my kid is talking to me. When they're not, they're just making a lilation sound that is part of how the human brain develops, even when you don't have the ability to hear others. The babies will just play with the sound in their brain.
Oh, this is very, very, is so enlightening, Prof. Really, really. I can see that, so the parents has a huge role to play.
Oh, absolutely. The major role is that of the parent. I hear parents say all the time, oh, I want to send my child with a special need to a school so some teacher can teach my child. No. The parents are a child's best teacher. I see a huge part of my job as teaching parents how to work with their child.
Because ordinarily, the kid, such kid with special needs spend most of their time at home with their parents. So
exactly. Exactly.
This is very important. Oh, Prof, I've taken much of your time, but notwithstanding, we still have just one or two more regarding child development. Prof, can you just provide us on what are the ways to make, what do you think we should do or the society should do to make the world better, especially regarding our responsibility towards kids with special needs?
So you're asking what kinds of things that we as a society can do,
at large,
and
yes,
the parent can do,
yes,
to help make the place a better place for children with special needs?
Exactly, Prof.
Okay,
exactly.
Well, one, parents need to understand they're not alone. They may not be a bunch of people who are close to them who can help them, but there are always experts who are available to help parents solve their problems. Even though every child is unique and every child's constellation of symptoms are a little different from every other child's, the similarities are so much so that parents need to work together. Parents who have a child with a special need should get together with other parents of children with special needs for support. Number two, the parent needs to be cared for. The hardest job in society is raising a child. Parenting is the hardest job in the world.
I accept that.
And it can be especially overwhelming if your child has a special need. So parents need and deserve to also be cared for. So parents need to know that the efforts they're making for their child are appreciated. And so they need to have a circle of friends who help give them a sense of emotional support for all the pain and work they're going through with their child. Number three, they need to know that it's okay not to be perfect. Sometimes we make mistakes when we're working with our children. No one's perfect. We all make mistakes every day. We can wallow in our mistakes, or we can move on. We've got to try and shift our thinking to not beating yourself over the head for your mistakes of the past, but instead start working to find more and more interventions to help your child. Number four, parents of a child with a special need to see themselves as a superhero. Now, I mean that in a figurative way. Sure, they can't leap a building over a tall building like Superman, but they're still a superhero because every day they're managing a situation with a child that is almost impossible. You have to, if the child has cerebral palsy, you have to exercise those muscles every day. You have to remember the child's medications if he or she has a seizure disorder. You have to hold a child who's freaking out when you're taking the child to a medical procedure, like the example of Adam, when we took him to the pediatric ophthalmologist on the other side of Istanbul. He freaked out. And so the mother had a hard time dealing with, we have to physically restrain him so that I could get an accurate check of what type of glasses he needed. So that means the mother had to hold his head down, and it was very stressful emotionally for the mother. And then hopefully you learn to manage temper tantrums and meltdowns, even your own, the parents' meltdown, so that you don't scar your child emotionally and socially and cognitively. You have to be the one who's encouraging the child, even if the doctors don't give you promising information, which means the parent can never give up hope, because there's such a difference between raising a regular child and a child with a special need. And then get it that therapy, when you're working with your child, should be thought of as play, and play should be therapeutic. Find ways to make your child's engagement in activities fun, playful, because play is the most effective way to enhance learning in the human brain, even for adults. And then at the same time, number 6, get it that play is therapy. Yes, I'm repeating that learning has got to be fun for the child, so that the child will transfer learning from short-term memory to long-term memory, even if the child has limited intellectual capacity, which is especially important for expressive language. And then 7, just enjoy your child, hugging, snuggling, playing with, laughing with your child. Read to your child. I just am shocked how few parents of a special needs child read to their child. You have to read every day, twice a day, to a special needs child, just like you would ideally to a typical developing child. And 9, or 8, I guess, be aware that these heart-wrenching decisions that you got to make are painful decisions that, for the benefit of the child, you got to make. Know that what you're doing is best. You got to trust yourself if you're a special needs parent. Now, number 9, parents won't always do the right thing. As I said before, many of the choices will be hard, will be painful, but parents have got to make those decisions. And sometimes it's going to give them a lot of emotional agony, but they've got to make a commitment for the best interest of their child. And then 10, they've got to forgive themselves. They've got to forgive themselves for the mistakes that sometimes we make as parents. I as a father of 6, lament the mistakes I've made. We all make mistakes as we're raising our children. But no amount of self-torture is gonna make you feel better about the choices you've made with your child who has a special need. And then 11, being a responsible parent is a hard job. Parenting is difficult, and it's extra hard if you have a kid with extra special needs. So however we treat the child, it's gonna come to the point where we can gain a sense of, I've accomplished this with my son, with my daughter. And 12, parenting a child with special needs is like a marathon. There's no breaks. You have to stay in the race. You can't eat halfway through. You can't stop and take a drink. You can't even pee, take a urine break. You just got to keep running. So like a marathon, parenting a kid with a special needs is going to go on for the foreseeable future, because we're in modern times where the average child with a special needs will live to be 50 or 60 years old. So you need to optimize as much cognitive potential as you can in that child to enhance the child's ability to eventually become able to take care of himself. But at the same time, number 13, don't lose yourself in your working with your child. You've still got to take care of your own emotional needs. When you're focusing all of your energy only on the child, then it's going to be harder for you to emotionally deal with your own stress. And 14, you got to keep a sense of humor. As painful as it might seem, there are things that humorously happen. I can give you an example.
Yes,
when of our 6 children, one had heart surgery at 6 months. And so he had oxygen deprivation after the surgery. And so he ended up with autism. So because he was, his grandfather was a violinist, my ex-wife's father was a violinist. He wanted to play the violin. So at age 4, little Fernando was playing the violin. And because he didn't get the concept of, well, you're supposed to play the minuet in G with all of the other people in the junior orchestra, he was up there on stage and went through the whole thing and then stood up and said, "I win." And so you just have to laugh. You just have to laugh instead of getting upset that he wasn't playing with the rest of the students, but somehow thought he needed to play it fast as he could. So you got to keep your sense of humor and then celebrate the little things that happen. And there'll be a lot of little things, like when the kid says his first word or his first sentence or smiles at you or gives you a hug. All of these, whatever developmental milestone that the child makes, accomplishes, celebrate that. And then 16, don't let other parents get you down. Try to remember that many other people lack the context of what it is like to raise a child with a special need. And 17, definitely don't compare your child ever to other children. Society can't keep comparing special needs children to typical developing children. We have to respect the individuality of each child. If a developmental milestone isn't met as you think it should, comparing kids isn't going to make things better. So your child is unique and you have to accept that individual uniqueness with all the child's challenges and strengths. Because the child will have a few strengths, like a child with Down syndrome typically is very loving. because of the part of the brain damage in Down syndrome in the limbic system makes them much more lovable than the average person. And then the second to the last thing that's important to remember is make time for your relationship with your spouse. Marriage is the second hardest job in the world. Parenting is definitely hard. Parenting a kid with special needs is even harder. So it takes a strong relationship between the husband and wife to keep that, to have the energy to keep going to support the child. And lastly, trust your instincts. If you don't think your child needs are being met, then seek a second opinion. I have many families from all over the world. Sometimes people call me from China or India to ask my opinion, even though they've already gotten a consult from another provider, or people back in the US call me, or from France. I just the other day had someone calling me from France to ask me my opinion. Even though they're competent pediatricians in France, but don't be afraid to ask for second opinions. Don't be afraid to fight for your child's needs. And society needs to understand that we need to respect the needs of special needs children, just as the United Nations has outlined through UNICEF. It's respect for the individual needs of every child, which is signed by all but 2 countries in the world. The International Rights of the Child.
Oh my God. Prof, really, this is a whole lot of information, not just information, but I mean, information that is quite useful, not only for parents with that have a kid with special need, but even to the society. Because if I'm to say from your own perspective, you are giving so much to the society as a humanitarian. And this is also a lesson for everyone. That is, we should be able to contribute our own, small as it could be, to the society. Prof, you've said so much, and I want you to say one more thing. How can I say? I would like you to say just one sentence. If, yes, one sentence that you think should be a better way to end this discussion on child development, and especially on the discussion with of kids with special kids. How will you end this particular section of the discussion with just one sentence?
Okay, well, it's going to be a compound sentence. So that I can have more words here. Okay, so what we as human beings need to do is respect the individual needs of every child, so that we're responsive to the cognitive, emotional, and social development of every child. And that requires us to realize that the key components of human growth and development are in respecting that a child has a need to actively explore their environment by manipulating their environment and producing things spontaneously through their play with their environment, and then wanting to interact with the adults around them.
No. Thank you so much, Prof. When you said a compound sentence, I was expecting you to keep speaking and talking for the next few minutes, but you were able to summarize everything within just a very short time. Thank you so much, Prof, for this very useful time. And really, we've taken much of your time. And I'm so happy you mentioned in one of your, while you were making the discussion, that you often have people contacting you from different parts of the world. I want to believe that there are so many people who will listen to this, some of our friends who will listen to this, and we find this information very useful. And they might request us to provide your details, specifically maybe email to contact you. So please,
absolutely,
we will definitely do that. And subsequently also, we hope to have you on this channel, especially, Prof, don't forget, we need to learn from you how you are able to be a successful and accomplished professor. We need you to guide us on that path. Thank you so much, Professor Williams, for your time. We really appreciate it. Thank you, sir.
Thank you for having me.
Yeah, thank you, sir.
Have a good day. Goodbye.